So page number 172, ಹಳೆ ಬುಕ್ಕಲ್ಲಿ ನಾರದ. Narada was at the lowest rung of the ladder, leading up to this region. He played his tune, no doubt, with his veena in one corner of the heart region. He was only the catcher of the sound or the shabda felt in the heart. He was absorbed only in the inferior type of the sound produced in the heart. Yeah. So underline the word shabda there, or the sound. So consciousness has a few things ಅಂತ ಹೇಳಿದ್ದೆ, ಜ್ಞಾಪಕ ಇದೆಯಾ? ಹೇಗೆ ಐಡೆಂಟಿಫೈ ಮಾಡುತ್ತೆ ಕಾನ್ಷಿಯಸ್ನೆಸ್? 3 things I told.
Light, sound, and vibration.
Good. And then the other 2 things to add is light, sound, vibration. And now that you are actually become more grounded with the concepts, we can build on it now to the next step. So light, sound, and vibration, colors, and conditions. Sarina. So light, sound, vibrations, colors, and conditions, and movement. Consciousness expand ಆಗುತ್ತೆ ಅನ್ನೋದಾದ್ರೆ there should be movement ಅಲ್ವಾ? Otherwise there is no question of expansion. Expansion is not possible without movement. So ಮೊದಲು 3 ಹೇಳಿದ್ದು ಜ್ಞಾಪಕ ಇಟ್ಕೊಂಡಿದ್ದು good. So light, sound, and vibration. Now add another 3 now. Colors, conditions, and movement. CMC ವೆಲ್ಲೋವರ್ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, CMC ಅಂದ್ರೆ ಜ್ಞಾಪಕ ಇಟ್ಕೊಳ್ರಿ. ಕಲರ್ಸ್, ಮೂಮೆಂಟ್ಸ್, ಕಂಡೀಷನ್ಸ್. ವೆಲ್ಲೋವರ್ ಅಂದ್ರೆ ವೈಬ್ರೇಷನ್ಸ್, ಮತ್ತೆ ಲೈಟ್ ಸೌಂಡ್. CMC VLS ಜ್ಞಾಪಕ ಇಟ್ಕೊಳ್ರಿ, ಆಕ್ರೋನಿಮ್. CMC VLS. So 6 ಆಯ್ತು. So when you are working on the consciousness, you can actually feel many of these things. One of the aspect is the sound or the shabda. That is what he has written here. So shabdadalli there are 2 varieties. One, when the shabda is caught in the heart region, it is the lowest kind of the shabda. When the shabda is caught in the higher regions, it is the higher kind of shabda. But before the shabda comes in, it is in the form of vibrations at the level of the 11th to 13th point. So that which is at the 11th to 13th point in the vibration state, as it comes down, it becomes a shabda of a higher quality. Then as it comes down into the Pinda Pradesh, it becomes a shabda of the lower quality. Sarina? Shabda is spoken about in the context of anahata and ajapa. Remember these 2 words, anahata and ajapa. Now, in some people, vibrations are felt. Although it's used the word vibration is used here, shabda is used for anahata and ajapa, it is more like an intense vibration. The anahata is generally felt in the heart region, in the heart chakra, anahata chakra. That's why it is called as anahata chakra. Anahata chakra means the chakra where the anahata sound is produced or anahata vibrations are produced. So it has 2 qualities. One is a vibrational quality, other one is a sound quality. Just like the photons have 2 qualities. It is a particle also, it is a wave also. Can you see photons? We see photons as a pocket of energy, so a particle of energy. Or we see photons also as a wave function. So both are there. Likewise, the anahata has 2 qualities. One is that it has a sound quality. The other one is that it's a vibrational quality. Okay. Now, when the anahata sound is produced, many people actually experience it as intense vibrations, or quite a few people also report that they are hearing some sounds. Now, what is the meaning of anahata? Ahata means friction. So when 2 things rub against one another, sound is produced. So if I do like this, there is sound. If I clap, there is sound. So when there is friction between two things, it produces sound. That is called as ahata sound, ahata shabda. Anahata means there is no friction whatsoever, but the sound is produced. That is the literal meaning of anahata shabda. Okay. Now, in the heart chakra, the anahata sound is heard or the vibrations are heard. In other words, when is the sound heard? When the vibrations becomes very intense, you hear the sound. You remember that the tuning fork? You take a tuning fork, strike it against the table. Initially, you hear a sound. After that, it appears that the sound is gone. But you take it near the ear. You still continue to hear the sound. Has anybody done this operation? We use this test in ENT. So that's why I'm just telling you the test. To test the hearing of a person, we do this. And then in the end, after the person says, I'm not able to hear, in the near the ear also, we place the tuning fork at the back of the ear on the bone here. And then if the person is able to feel the vibrations from the bone, we say that the bone conduction is better than ear conduction. So this is a ENT test. So if at all at any point of time you have difficulty in hearing, you can test it yourself at home, provided you have a tuning fork with you. So three levels. You just strike the tuning fork onto the table, you hear the voice, you hear the sound. That's one level. Now, why is the sound produced? Because there is intense vibrations. Okay. Now, when the intensity of the vibrations comes down, you take it near the ear. You still hear the sound, although it is not heard from far. In other words, the vibrations are still persisting. That's the second level. Third level, now when you put it near the ear and you are not able to hear the sound, you put it at the back of the ear. There's a bone here, just back of the ear, there is a bone. You put the tuning fork base and on that bone, and then ask the patient whether they are able to feel the vibrations. If the patient says, yes, I'm able to feel the vibrations now, when you put the base of the tuning fork on the bone here, it is called as bone conduction. So the skull conducts that vibrations. So you're able to hear. So one is bone conduction, other one is ear conduction. Now you are going to core medical thing now. And different medical conditions, it varies. In some middle ear problem, the air conduction is impacted and the bone conduction is not impacted. Something in the sensory neural loss where there is a problem with the nerves itself, the bone conduction is also impacted. So we can differentiate different types of deafness based on these tests. Now earlier, this was the basic test that was being done in the clinic itself. Now we have got audiometry. In audiometry, there are many other parameters which are tested. Okay. Anyway, coming back to the issue, why I said that there is a vibrational quality and the sound quality, this is the reason. So this test is a very simple example why there is a vibrational quality and a sound quality. When the vibration is intense, it is felt as sound, shabda. When the vibrations are less intense, it is felt as vibrations. Does it make sense? So there are two qualities to that. So what is this CMC VLS? Just somebody can elaborate on the CMC VLS?
Color, condition, and
CMC.
my M M for
M1 ಮರ್ತೋಗಿದೆ ಉಕ್ಕಿದೆಲ್ಲ ನೆನಪಿದೆ.
M is movement.
movement,
So colors, movement, and conditions.
condition,
VLS,
Vibration, light,
vibration, light, sound.
good. So six aspects of consciousness. Now, when you take, why am I actually elaborating on this particular point? Because when you take the sitting, you are likely to experience some of these changes in these things. That is the importance of knowing this. It's not just theory. It is useful for your day-to-day sittings. So during the course of the sittings, when you do meditation yourself or take a sitting or satsanga, you should be able to feel some changes in these CMC VLS, and that is an indication for you that the work is occurring on your consciousness. Because many times people say that I can't relate to the work on the consciousness. How can I relate to it? This is how you relate to it. And among these, one aspect is the feelings. The conditions is the
You
feelings that you're talking about.
okay? So color we observe. Condition is the feelings. What is movement?
You feel the moment, you feel the energy movement from
Correct.
this way, and then you feel the movement from one chakra to the next chakra. Say, for example, when the work starts, suppose the first chakra is being worked on. After 10 minutes, you feel that the work is now progressing to second or third chakra. So that is the movement
Okay.
that you feel in different chakras.
Okay. And vibration we feel, light we feel, sound we never feel, right?
Sound is something that they used to take it as very seriously in the past. In fact, one of the things about sound is that they used to look at sound, the hearing of the sound or feeling of the sound, as an indication of the spiritual work having started in an abhyasa. Okay, that was one of the things that was being practiced 50 years back. We no longer do that. We no longer insist that the sound needs to be heard, although there are sounds at every chakra. It only is grasped by the people who are very sensitive to those sounds. And I gave you the relationship between the vibrations and the shabda. Two things. If the vibrations becomes intense, you hear the shabda. Or if you are very sensitive to finer vibrations, you hear the shabda. In both these conditions, you hear the shabda. If the vibrations are finer and your sensitivity is not so strong, then you will probably not hear the shabda, but you feel the vibrations. That is what happens with most people.
I have one more
ಆದಿತ್ಯ
question.
ಬಂದೇನೋ ಯು ಕೆ ಇಂದ ಲಾಗಿನ್ ಆಗಿದೆಯೇನೋ ಅಥವಾ ಸಿಂಗಪೂರಿಂದಲೇ ಲಾಗಿನ್ ಆಗಿದೆಯಾ? ಆದಿತ್ಯ ವಿ ಹೆಚ್ ಅಂತ ಇಟ್ಕೊಂಡಿದ್ಯಾ? ನಾವು ಮಾಮೂಲಿ ಬರೋ ಆದಿತ್ಯನೇ ಅಂತ ಅನ್ಕೊಂಡಿದ್ರ? ಸೊ ಆನ್ ದ ಟ್ರೈನ್. ಓಕೆ.
I have one more
ಆದಿತ್ಯ ವಿ
question.
ಹೆಚ್ ಅಂತಾನೆ, ಆದಿತ್ಯ ವಾ ಹೆಚ್ ಅಂತನೋ ವಿ ಹೆಚ್ ಅಂತನೋ? ಪೂರ್ತಿ ಹೇರ್ ಸ್ಟೈಲ್ ಎಲ್ಲ ಚೇಂಜ್ ಮಾಡ್ಬಿಟ್ಟಿದ್ಯಾ? ಮನೆ ಹೋಗಿ ಮಾತಾಡು, ಸರಿನಾ? ಸೊ 6 ಥಿಂಗ್ಸ್, ಅಂಡ್ ನೌ ಯು ಗಾಟ್ ದ ರಿಲೇಶನ್ಶಿಪ್ ಬಿಟ್ವೀನ್ ವೈಬ್ರೇಷನ್ ಅಂಡ್ ದ ಸೌಂಡ್. ನಾವು ಅನಾಥ ಹೇಳ್ತಿದ್ನಲ್ಲ, ಈಗ ಮೆನಿ ಟೈಮ್ಸ್ ಇನ್ ಸಮ್ ಅಭ್ಯಾಸೀಸ್ the first
Brother, I have
vibrations
one
are
question.
either felt or heard in the heart, and that is called as anahata. Then what happens, as and then the vibrations now becomes more intense, it starts spreading from the heart to all parts of the body. It spreads to the Agna chakra, and then it spreads to all parts of the body, to every cell. These vibrations are now felt throughout the body. When it is felt throughout the body or in the Agna chakra, it is called as ajapa. In other words, you are not uttering any japa, but the vibrations are felt here. Does it make sense? Ajapa means you are not uttering any japa, but you are actually feeling the vibrations like a japa, as if you are uttering the japa. Now I want you to do an experiment. After the class is over, sit down at one place and then just close your eyes. Just utter the word Om and see where all you can feel the vibrations. Do this experiment. All that I want to do is just utter the word Om with full vibrations for about 5 minutes. That's enough. And then what I want you to focus your attention is on where all in the body you are able to feel the vibrations. Okay. Now in this context, I want you to pay attention to the Moola mantra of each of the chakra. Every chakra in the body, the 7 chakras that we talk about. What are all the 7 chakras? If somebody says,
ಮೂಲಾಧಾರ, ಸ್ವಾದಿಷ್ಟಾನ.
So Praveen is looking to the left to catch hold of the chakra. Gopal Krishna, you look to the right and catch hold of the chakra now.
I
ಇನ್ಯಾವುದು ಆಮೇಲೆ ಮೂರನೇದು
ಮಣಿಪುರ್.
ಬಬ್ರುವಾನನ್ ಊರು. ಬಬ್ರುವಾನನ್ ಯಾವ ಊರು? ಮಣಿಪುರದ ಅರಸು. ಬಬ್ರುವಾನ ಈಸ್ ಫ್ರಮ್ ಮಣಿಪುರ. ಮಣಿಪುರದ ಅರಸು. ಸೊ ನೀವು ಬಬ್ರುವಾನ ಸಿಂಹ ಜ್ಞಾಪಕ ಇಟ್ಕೊಂಡ್ರೆ ಮಣಿಪುರ ಚಕ್ರ ಜ್ಞಾಪಕ ಇರುತ್ತೆ. ಈಗ
movies is the base for remembering Sanskrit words.
see, it doesn't matter what is the base. You remember some cinema and then you will remember the chakra. Why not? Manipurada Arasu is the third chakra. It's very, very critical. Manipur chakra is very critical for health. If
What is the actual meaning of Manipura?
weakened, you will not be able to digest the food that you eat. Manipur
That
chakra
is
is
fire
one which
element.
digests the food. Then after that, fourth chakra,
Anahata.
fifth one,
Agna.
No. Agna is sixth.
fifth
Then
one,
Vishnu.
V ಇಂದಾನೆ.
Vishuddhi.
Vishuddhi.
Vishuddha chakra. So Vishuddha, Agna, and then the seventh one is
Sahasradalkama.
here. On the
SDK.
meeting nervous system, seventh is here. The 10th chakra, which is the last one, the seventh chakra,
Sahasradalkama.
SDK, Sahasradal coming. So can somebody else repeat now? Not Mogre. Mogre has played with the chakras. Now somebody else can repeat it.
Mooladhara, Swadhisthana, Manipura, Anahata, Vishuddha.
ಅನ್ನದಾತ ಅಲ್ವೋ?
Anahata.
ಅನಾಹತ. ಅನ್ನದಾತ ಅಂತ ಕೇಳಿಸ್ತು ನಂಗೆ.
Hearing test. Anahata, Vishuddha, Agna, SDK.
SDK ಅಂದ್ರೆ
Sahasradal Kamal.
ಸಹಸ್ರದಳ ಕಮಲ. 1000 petal lotus. Sahasradala means 1000 petal.
Agna
Lotus.
in what is actually Agna meaning? Agna ಅಂತಂದ್ರೆ ಏನು?
Command.
ಈ ಒಂದೊಂದೇ ಚಕ್ರಕ್ಕೆ ಬರೋಣ. ಫಸ್ಟ್ ಮೂಲಾಧಾರದಿಂದ ಶುರು ಮಾಡೋಣ. ಮೂಲಾಧಾರದ ಕೆಲಸ ಏನು?
Earth element that gives the base actually.
Correct. Base element. Okay. What is the element there?
Earth.
Earth element. So what is the function?
It gives, I think, stability. It brings in the system.
That is the word I was looking for. Stability. The word Mooladhara is split into two. Moola plus Adhara is Mooladhara. Moola means fundamental. Adhara means stability, a foundation. So Mooladhara actually gives stability to the person. Earth gives stability for us to live on this planet. If the earth itself is shaky, if it's not stable, we cannot live on this planet. So like earth gives stability, the Mooladhara chakra gives stability to the individual.
Color associated with this, I forgot. This is yellow or no?
I'll
It's
tell
not
you an
white,
easy
it's
way
not
of
green.
remembering it. We'll tell you an easy way of remembering the colors of the chakra. Okay? So the reason why we are speaking about these 7 chakras is that each of the chakras has different colors and different Moola mantra, base mantra. So the chakra of this, the mantra of this chakra is a lam. Why is this important? If you know the Moola mantra of a particular chakra, you can actually do the japa of that particular mantra and you can strengthen that particular chakra. That's why you need to know about it. That's another way of actually curing our illnesses. All the illnesses in the body is related to 7 chakras only. So suppose somebody has constipation, somebody has piles, fissure, fistula, anything which is going to relate to the excretion, that is related to Muladhara chakra. So it allows normal excretion to occur from the system. So if somebody has constipation or fissure, fistula, whatever, any problems with the excretion, they have to utter the mantra 15-20 minutes, lam mantra. When you utter the mantra, you need to feel the vibration in that particular chakra. That's how you utter. You close your eyes, bring the attention of your mind on the Muladhara chakra and utter the word lam. You can actually clearly feel the vibrations in that particular chakra. One who has practiced this, we have practiced it, that's what I'm saying. I'm telling you by experience. This was something which was taught to us and we practiced for a few months. You can actually feel the vibrations in that particular chakra. Okay? Now, that is the fundamental thing. Lam is the mantra for that chakra. And then there are different number of petals for each of these chakra. That's something that you can remember, you don't remember, that's okay. You don't need to worry about the number of petals. But there are a different number of petals for each of these chakra. Okay? And then second chakra is
Swadhisthana.
Swadhisthana. Again, it is split into two. Swa plus Adhisthana is Swadhisthana. Swa means self. Swayam. Self. Swa means self. Adhisthana means where it is embedded or it is staying. So Swa Adhisthana means the part of the body where the lower self is staying. Swa Adhisthana. So there is a lower self. Now the lower self is related to the reproductive function. You remember when people grow up, they want to get married and they want to have their own kid. They want their, what do you say, the family to prosper. So this feeling that I am the father, see, we identify closely with the body. Since we identify closely with the body, we also identify with the progeny. Our progeny is nothing but our own kids. And we identify with them as our own. Like we identify with our body. We almost consider the kids as extension of our body. Because they are born out of our body only. And this Swadhisthana chakra is something that is going to be helpful in that particular function, reproductive function. So anybody who has infertility, anybody who has PCOD problems in females, anybody who has urinary tract problems, they can all actually utter the mantra Lam Vam. Vam is the mantra for the Swadhisthana chakra. Lam Vam. So you can actually tell these to some of your friends who might have difficulty in getting kids. Nowadays, a lot of youngsters have difficulty getting kids. So you can actually utter them, ask them to utter the mantra Vam, both the husband and wife to utter the mantra Vam. Then they are more likely to increase the chances of getting their kids. Because the Swadhisthana chakra will start functioning better, the reproductive organs will start functioning better, and then you are likely to get a kid. Other function of Swadhisthana chakra is that it is the seat of creativity, lower seat of creativity. The higher seat of creativity is the Brahmanda Mandala. When we enter into the Brahmanda Mandala, we are very creative because we get a huge amount of freedom. The lower seat of creativity in terms of physical creation, that's why it's related to the reproductive organs. The lower seat of creativity, again, is because of Swadhisthana. So Swadhisthana is related to two things, creativity and the reproductive functions. Okay. Now the third chakra, which is Manipura. So in other words, it is Mani plus Pura. Manipura, it has two words again. Mani plus Pura. What is the meaning of that Manipura? It is the crown jewel of all the chakras, as far as the body is concerned. So the entire thing, functioning of the body, is dependent on the Manipura chakra. It is the jewel, Mani, of the Pura. If you take this body as the Pura or the house, Mani is the jewel of this Pura. So that is why it is called as Manipura chakra. Now, what is its function? Its function is almost in everything that we do. It is partly related to motion of the large intestine. It is related to the motion of the stomach. It is related to the digestion from the liver, from the pancreas, the duodenum, the intestine, juice, everything. It is related to the functioning of the kidney. It is related to the functioning of the liver. It is related to the functioning of the ureter, which comes out from the kidney. Every aspect of our functioning is entirely dependent on the Manipura chakra. It is one chakra that supplies a maximum amount of energy to maximum amount of organs in the body. So that is why it's like a crown jewel among the chakras. If somebody wants to be very healthy, they have to take care of the Manipura chakra. Without taking care of the Manipura chakra, you will not be able to be very healthy. So anybody who has health problem, they can actually benefit by uttering the mantra relating to the Manipura chakra, Lam Vam Ram. Ram is the mantra for Manipura chakra. Okay. Now next chakra, which is Anahata chakra. So Manipura chakra is like, it is necessary for every functioning. Okay. So if somebody has liver problem, they can utter the Manipura chakra mantra. If somebody has pancreas problem, digestion problem, gastric motility problem, gastric problem, any problem related to the entire stomach, except for the reproductive organs and the excretion, it is related to Manipura chakra. Okay. So it's very, very fundamental. That's why it's also called as sometimes a solar chakra. It is the main producer of the heat in the system. Jataragni, the intestinal power of digestion, is produced by the Manipura chakra. It is called as Jatara Agni. Jatara Agni means, Jatara means intestine, Agni means fire. Intestinal fire for digestion and absorption is by the Manipura chakra. So if somebody wants to lose weight, you utter the Ram mantra. You can start losing weight.
Swadhisthana is water, right?
In terms of elements, Swadhisthana is water, and in terms of elements, the Manipura chakra is fire element. So when we increase the fire element in the body by uttering the Manipura chakra mantra, it burns fat. Like when you put ghee into the fire of yagna, it burns the ghee. Likewise, the Manipura chakra burns the fat in the system. So that's one of the, because it contains the fire element, and that's what it does. Okay. Then come to the fourth chakra, which is Anahata chakra. Again, that is made up of two words, An-ahata. I just explained what is Anahata. An-ahata. Anahata means An plus Ahata. One where there is sound produced without any friction. That is Anahata. That is the fourth chakra, and the element there is air element. Okay. And what's the other point that you were talking about? The function of the Anahata chakra is to supply energy to the heart and the lungs. That is its main function, Anahata chakra, to supply energy to the heart and the lungs. And Anahata chakra is another important chakra because at the Anahata chakra, it has two qualities. At the lower end, it has a material quality to it. At the higher end, it has a spiritual quality to it. So all the animals are only leading an animalistic life because only lower three chakras they are using for their life. But it's only in the human that this heart chakra is very active. That's why human beings can actually become spiritual. It's because of the heart chakra. That's the starting point of spiritual journey. And that's why we meditate on the heart. Although we don't meditate directly on the heart chakra, we meditate on the heart as a physical organ. Okay? Lam, Vam, Ram, Yam. Yam is the mantra for heart, the Anahata chakra. Lam, Vam, Ram, Yam. You can by heart this. I have already by hearted it. That's why I'm able to remember everything. When we were doing it, we used to utter this mantra. So that's why we were kind of got embossed with it, printed inside. So Lam, Vam, Ram, Yam. In a way, you can remember that if the heart stops means you go to Yama. So that's how you remember the heart chakra is Yam. Don't stop it. Then you are a guest of Yama. If the Yam stops here, we go to Yama. Okay. Anyway, that is heart chakra. Then you come to the fifth chakra, Vishuddha chakra. Vishuddha again is made up of two words. Vish plus Shuddhi. It has two kind of meanings to it. In one way, you can look at it as a special kind of purity. Visheshavadanta Shuddhi. Vishesha Shuddhi. That means special kind of purity. Or the other way of looking around this is Vish plus Shuddhi means you have now got rid of all the vish or the poison in the system. And now you attained the state of purity. After getting rid of the poison in the system, Vishka Shuddhi, Vishuddhi. So this is the fifth chakra here. And that is something related to what is related to today morning I told Gopal Krishna, I told you 4 things in the morning, repeat it. Vishuddhi chakra, we spoke about it in the morning.
It is the point where conscious mind meets subconscious mind.
First one.
It is the point of
Now he is looking at the phone.
bhakti. Is the point of bhakti.
Bhakti. Third one.
It is the point where dreamy states meet waking state.
Fourth one.
It is the point of udana.
Udana. Or
Udana.
Udana. I call it as Udana just for the sake of ease of remembering. It is Udana, but we call it as Udana. I'll tell you why I call it as Udana. And fifth one,
Point where dreamlike experiences happen in meditation.
you already said that. That was the third point that you mentioned.
ಇಲ್ಲ
What's the
ಇಟ್ಸ್
fifth one?
ಡ್ರೀಮಿ ಸ್ಟೇಟ್ಸ್ ಮೀಟ್ಸ್ ವೇಕಿಂಗ್ ಸ್ಟೇಟ್ ಅಂತ ಅದು ಇದು ಲೈಕ್ ಮೆಡಿಟೇಷನ್ ಒಳಗೆ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್.
So Aidu. Vishuddha chakra has 5 special qualities. Okay. So one, apart from what we read in our book, that is the point of clarity. It's the point of bhakti or devotion. It's the junction between waking world and the dream world. It's the junction between conscious mind and the subconscious mind. It is where you experience dreamy state in the meditation. And what's the last one? It is the point where the Udana prana operates. There are Pancha pranas. You remember Pancha prana? I think Aditya will know about Pancha prana. This is not Pancha prana. This is Pancha prana.
ಸ್ವಲ್ಪ ಮಾತ್ರ ಜ್ಞಾಪಕ ಇಲ್ಲಿ ಎಲ್ಲಾನು ಅಪಾನ ಅಂಡ್
ಯಾರು ಸಂಧ್ಯಾ ಒಂದೇ ಮಾಡಲ್ಲ, ಎಲ್ಲರೂ ಮುಂಜಿ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಯಾರ್ಯಾರು? ಗೋಪಾಲ ಕೃಷ್ಣನ್ಗೂ ಮುಂಜಿ ಆಗಿದೆ, ಇವನಿಗೂ ಮುಂಜಿ ಆಗಿದೆ, ಯಾರು ಆದಿತ್ಯನ್ ಮುಂಜಿ ಆಗಿದೆ, ನಮ್ಮ ಯಶಸ್ಗೂ ಮುಂಜಿ ಆಗಿದೆ. ಹೌದೋ ಇಲ್ಲ? ಎಲ್ಲರೂ ಮುಂಜಿ ಮಾಡ್ಕೊಂಡಿದ್ದೀರಾ. ಆದ್ರೆ ಯಾವ ಮಂತ್ರನೂ ಕೇಳಬೇಡಿ. ಆಯ್ತಾ? ಪ್ರಾಣ, ಅಪಾನ, ವ್ಯಾನ, ಉದಾನ, ಸಮಾನ, ಸಪ್ರಾಣ, ಶ್ವೇತ ಎನಸೆ ಗೋತ್ರ, ಗಾಯತ್ರಿ ಚತುರ್ಭಿಂ, ಶತ್ಯಕ್ಷರ ತಿಪ್ಪತ್ತ ಷಟ್ ಕುಕ್ಷಿ ಪಂಚಶಿಷ್ಯೋಪನೆ ವಿನಿಯೋಗ ಅಂತ ಹೇಳ್ತೀರ. ಜ್ಞಾಪಕ ಇದೆಯಾ? ಅದರಲ್ಲಿ ಫಸ್ಟ್ 3 ವರ್ಡ್ಸ್ ಇದೆಯಲ್ಲ, ದಟ್ ಗಿವ್ಸ್ ಯು ದ 5 ಪ್ರಾಣಸ್. ಪ್ರಾಣಾಪಾನ, ಪ್ರಾಣ ಅಪಾನ, 2 ಪ್ರಾಣ. ವ್ಯಾನೋದಾನ, ವ್ಯಾನ ಉದಾನ, ಸಮಾನ, 5 ಪ್ರಾಣಸ್. ಸೊ ಪ್ರಾಣ, ಅಪಾನ, ವ್ಯಾನ, ಉದಾನ, ಸಮಾನ, 5 ಪ್ರಾಣಸ್. You write it down. Prana means when the breath is taken in, that is prana. When something is thrown out of the body, it is called as apana. So for example, we throw out the stools out of the system, that is apana function. We throw out the breath, the expiration, that is apana. We throw out the sweat from the skin, that is apana. They're all functioning related to the apana. Apana essentially means throwing out from the system. Prana is nothing but taking it to the system. For example, you take in the air in inspiration, that is prana. You take the food, that is prana. You take water, that is prana. Anything that you take in is prana. Anything that you throw out is apana. Does it make sense? So prana, apana. Then vyana. Vyana is the one, whatever you take in, it needs to get distributed throughout the body, no? So the function of the vyana is to distribute everything. Whatever you take in, the air is taken in, then it goes to the lungs. From the lungs, it goes to the heart. From the heart, it goes to every part of the body, every cell. That is the function of vyana. You take food, it goes into the stomach, then it is digested in the intestine, then it is absorbed into the bloodstream, then it is distributed to every cell in the body. Now that is again the function of vyana. So vyana is the distributor of everything. Okay. Today morning I mentioned, after the sitting, certain things about vyana. What did I mention? I was giving examples of patients.
If
Which
prana,
one?
if samskaras are accumulated in a certain part of the body,
So
where
which example I gave?
ಆಂಪ್ಯುಟೇಷನ್ ನೆನಪಿದೆ. ಆಂಪ್ಯುಟೇಷನ್ ಎದಕ್ಕಾಗತ್ತೆ ಅದು ನೆನಪಿಲ್ಲ. ಅದು
Amputation, which
ಗ್ಯಾಂಗ್ರೀನ್,
gangrene. But gangrene for what? In which patients?
ಡಯಾಬಿಟೀಸ್.
Diabetes is the most commonest reason. So when people get uncontrolled diabetes, the samskaras accumulate in peripheral parts of the body. The vyana is not able to traverse through the peripheral parts of the body. So the peripheral parts of the body do not get the energy or the prana. So now they start decaying. When they start decaying, because the prana shakti is not able to flow through it, it becomes gangrenous, it becomes dead. So then the doctors say that if it is continuous like that, it's going to be affecting the life itself. So they amputate the finger. It's very common. Commonest reason for people to get amputated nowadays is diabetes. And people take diabetes as very simple illness. Oh, just with sugar. No, no, no. I've seen many people undergoing amputation because of uncontrolled diabetes. Very common nowadays. And when people eat a lot of burgers, and when people eat a lot of bende biscuit, you need to be careful. Lot of croissants, lot of bakery items, lot of fresh fruit juices without the fiber. It's always better to eat fruits, not fruit juices. At your age, you are safe. But as we grow older, we need to make sure that the vyana functions well in the system. That's one of the things that happens in meditation. When you undergo the cleaning process, you allow the samskaras to be removed from the peripheral parts of the body also. So the periphery actually is flush with life. And when you take pranahuti, we are actually giving you the life force. Pranahuti is pranasya prana. So when pranahuti is given, that is the life of life. So that can get converted to sukshma prana and stula prana. and that nourishes the life in our system. So it's a very, very unique system for you to be able to get the pranahuti. There is nothing like this in the entire world where you are able to get that pranasya prana. Here we are struggling just by breath to hold on to the prana. But when you get pranasya prana can get converted into either sukshma prana or stula prana. And that's how, when you take a sitting regularly, you actually protect your health. The first benefit that you get when you take a sittings regularly is that it protects your health. How? It removes the samskaras so that there is free flow of the prana. And when you take pranahuti, that pranahuti nourishes the pranashakti. So in two ways, you are actually getting benefit of your health by taking the sittings regularly. Remember that. Okay. Anyway, coming back to the Panchaprana, 5 pranas. So prana, apana, vyana, I told you. Now udana. Udana is the throat chakra. It is established at the throat chakra. Now, what is the function of udana? The function of udana is to attach the life to the body. It is like the antenna attaching to a particular thing. You remember there is a satellite. There are 5, suppose there are 5 strands to the satellite. So that 5 strands actually provides a base. It attaches to a particular thing. So the udana is like a central attachment to the body. At the time of death, the prana is withdrawn from the body. The subtle body and the soul and the causal body. The causal body, subtle body and the soul get detached from the udana and then goes out of the system. So it is the separator of the prana at the time of death. Udana or Udana chakra, which is there established in the throat chakra. That's one of the functioning of the throat chakra. That it helps in separation of the prana from the physical body. When the prana is withdrawn from the udana and it goes to the agna, then this entire lower part of the body is now dead. Okay, so it's a chief operating force. As long as the udana is still attached to the body has chance of survival. The moment that this is withdrawn, the life force is withdrawn from here and back to the agna chakra, then the chances of revival is very minimal. Okay, that's the 5th chakra. Then the 6th chakra is Agna chakra. In Kannada, we use the word Agne. Agne means
Brother, this Udana ಆದ್ಮೇಲೆ ಏನು?
Udana ಆದ್ಮೇಲೆ last Pancha Prana is Samana. Samana Prana. Last one, 5th one. Samana. Samana Prana is established in Manipura chakra. Samana Prana is the main prana that helps in digestion. So the 5 chakras has 5 different functions. The Mooladhara chakra has apana function. The Swadhisthana chakra has prana function. The Manipura chakra has samana prana, digestion function. Samana prana has digestion function established in Manipura. The Vishuddha chakra, illa inyavudu Manipura ayitu. Heart chakra, Anahata chakra. Heart chakra has again prana function. And basically we take in the breath, the prana function. The Vyana prana has a peripheral circulation. It distributes everything, the food, air, whatever, water. That is Vyana function. And the Udana function is in the Vishuddha chakra. Except for the Vyana function where it is spread across the chakras, the other chakras have related only one function.
You didn't say what is the sound of Vishuddhi.
We are coming to the mantra of the Vishuddhi. So, Lam, Vam, Ram, Yam, Hum. Hum is the sound of Vishuddhi. Hum is the Bijakshara mantra. It is
And
called as Mula mantra or Bijakshara mantra.
element associated is space, right?
Space or ether. Then the last two chakras, we'll finish it today for that, and then we'll continue next class. Agna chakra. Agna chakra, again, we don't talk about element there, although in our system we talk about as the earth element, finer earth element, or you can talk it to call it as the essence of earth element. That is the Agna chakra. And there, the Moola mantra or Bijakshara mantra is Om. Okay. And the main function of Agna chakra is to give Agne. Agne means order, enabler. It's an Agna chakra is an enabler. Enabler of what? Enabler of the life force sustaining in this particular body by allowing the distribution of the energy that is flowing from the Agna chakra down to the Pinda Pradesh. So Agna chakra is like ordering or enabling the life force to persist in this particular body. Okay. And the first chakra to receive the energy from the Agna chakra is the fifth chakra, Vishuddha chakra. That is why the Udana is situated there. As long as the Udana is active, our body can be revived. The moment the prana, Udana prana is taken back to the prana is removed to the life force is removed to the Agna chakra, there is no guarantee that that person is going to survive. So the mantra is Om. Bijakshara mantra is Om. Last one is Sahasradal Kamal. And the Bijakshara mantra for that is Soham. Soham. So means like, Ham means like, I am like you. Soham, I am like you. So relating to God. So there are many systems where they practice uttering of the mantra Om or Soham. Om chanting or Soham chanting. There are many sanस्थas who follow this.
So this is Saha and Aham, right?
Soham.
Saha,
You can split it into multiple ways.
he is I.
Just like you, I am like you. It's very similar to Tattvamasi mantra, no? Tattvamasi. Very similar. Soham. In different words, that's all. So these are the 7 chakras, and how to remember the colors? From top to bottom, you remember Vibgaya. That's how you remember the colors. So the Sahasradhara Kamar is violet, Agna chakra is indigo, Vishuddha chakra is blue, Vib, Heart chakra is green, Manipura chakra is yellow, Swadhisthana chakra is orange, and Mooladhara chakra is red. So Vibgaya. That's how you remember. Easy. You have read it in science. So 7 colors, 7 chakras. Okay. We got distracted from Narada's Shabdas to all the chakras and the pranas and everything. So Narada's one tune today has elicited 7 chakras and 5 pranas to all of us. But it was quite informative. You can actually apply all these things to medical science also. Many times I keep explaining to people whether this fellow is going to survive or not. Why are they on what basis I'm saying that this fellow is going to survive? So I analyze from the Pancha Prana perspective and give the analysis. This fellow is going to survive in the ICU. This fellow is not going to survive. Betting. But it is calculated betting. It is not just blind betting. It is hypotheticated on the 7 chakras and 5 pranas. When I see more than 3 pranas are working, and when I see more than 4 chakras are working, I'm more optimistic that this fellow is going to survive.
I have just one question. Now coming to your psychological terms, when a person starts knowing so many things, isn't it possible that he starts hallucinating, or he is not experiencing that thing, but he starts thinking, okay, I'm experiencing. So how you take those things?
I hope that you don't feel that I'm hallucinating, though.
No, no, but as just No, ಅಂದ್ರೆ
No, I
ಈಗ
got your question. I got your question. I'm just pulling your leg. So now I have to teach you how to recognize a person who is hallucinating. Right. We will park that question. We will continue with that question maybe tomorrow, 7 to 8. Okay. So we'll start from hallucinations. Okay. So ಆಯ್ತಾ ಆದಿತ್ಯ ಊಟ ಆಯ್ತಾ?
ಅಂಕಲ್ ಇಲ್ಲ ಮಾಡಿ ಬಂದೆ.
ಹೌದಾ? 10:30 ಆಯ್ತಲ್ಲ? 10:30 ಅಲ್ವಲ್ಲಿ ಇವಾಗ?
ಈಗ 10 ಹೌದು.
ಹ್ಮ್. ಆಯ್ತು. ಸರಿ, ನಮ್ಮ ನೆಕ್ಸ್ಟ್ ಕ್ಯಾಂಡಿಡೇಟ್ಸ್ ಮೀಟಿಂಗ್ ಇದೆ. ಎಲ್ಲ ನೀವು ಚಕ್ಕರ್ ಹೊಡಿತಾ ಇದ್ದಾರೆ ಕ್ಯಾಂಡಿಡೇಟ್ಸ್ ಮೀಟಿಂಗ್ಗೆ. ಈಗ ಆ ಮೀಟಿಂಗ್ ಹೋಗ್ಬೇಕು. ಆಯ್ತು. ಆಯ್ತು ಕಣ್ರಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಫಾರ್ ಯುವರ್ ಟೈಮ್. ಓಕೆ.
thank you.
ನಮಸ್ತೆಪ್ಪ. ಗುಡ್ ನೈಟ್.
ಥ್ಯಾಂಕ್ ಯು.
Thank you.